Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is a returning guest. Home birth midwife Vicki Hedley is returning to speak today on the power of placentas. Vicki Hedley is a certified professional midwife through the North American Registry of Midwives and a certified midwife through the American Midwifery Certification Board. She graduated from the National College of Midwifery in Taos, New Mexico, and is licensed to practice midwifery in New Jersey and New York. She has 18 years of experience, having attended over 500 births in hospitals, birth centers, and homes. She started her midwifery journey as a birth and postpartum doula trainer, and childbirth educator. Vicki is the owner of Seventh Moon Home Birth Midwifery Services with locations in Montvale and Hoboken, New Jersey, and her website is seventhmoonhomebirth.com. Welcome, Vicki.
Hi, Laura. Nice to be here again.
Hi. Yes, I'm excited to have you back on the show, and you're my first guest who is returning for a second round. So I'm thrilled that we can explore your breadth and wisdom of knowledge regarding birth from a different perspective, and it's really regarding the placenta and placenta encapsulation. So let's start off the conversation with explaining what is the placenta.
So, I find it amazing, actually, the placenta. I have actually been at a birth with a woman whose mother had 12 children, and this was the woman's fourth baby who I was helping. And the mother, who had 12 children, had never even seen a placenta before, and she had 12 children. So just the fact that it really is necessary to describe what is a placenta, because not everyone knows what it is, and certainly not everyone have seen the product that their body made to nourish their baby. So thank you for the opportunity to have this conversation. The placenta is actually, it's as we know, it's what nourishes the baby. It's an organ that is made by the pregnant person. It's actually made with the baby, because when the egg comes into the uterus, it attaches, of course. You now have to find a place on the uterus where there's lots of wonderful blood supply, and it then attaches. Well, part of it becomes the placenta, and part of it becomes the baby. So really, when you ask what is the placenta, one could say that the placenta is the baby. Because when the placenta is growing, it is attached to the mother's body, but it is not part of the mother's body. It's actually much more part of the baby in a very real way, because the cord develops in between the placenta and the baby. So this attachment that comes into the mother's uterus is part of the baby, which I think is kind of a fascinating understanding. It's the only organ, actually, that's made, used for a specific purpose, and then disposed of, because we actually dispose of the placenta afterward.
It's the same genetic material as the baby.
The same genetic material as the baby. It's fascinating.
Yeah.
And
that is fascinating.
It kind of grows commensurate to the baby, so one would expect that a smaller baby would have a smaller placenta, and a larger baby tends to have a larger placenta, and that, of course, is related to nutrition of the woman and health of the woman and all of that. And there are certain, diseases perhaps of pregnancy that would make a smaller placenta, preeclampsia, for example, or, IUGR or something like this. But in general, you could say that, a larger baby would have a larger placenta. And the nutrients from the mother go through the cord into the baby, and there are 2 arteries and a vein in the cord, and the vein brings the nutrients from the mother to the baby, and then the arteries bring the blood back into the mother's system so that she can then take care of that for the baby. So the placenta, of course, is also, it's nutritious in that way. That's the whole point of it. There's the nutrients go through it. It's loaded with hormones and all of that.
Mm-hmm. Yeah, it's fascinating. So I think that's important to explain, that this is not something that is from the woman's body, but it's actually from the egg and the sperm those first few days as they're developing into that embryo, that that part of it splits off to create the placenta to support the fetus through the rest of the pregnancy.
I'm continue to be blown away by it. We actually, in our practice, it is a very honored part of the birth. You know, in the hospital, I've had many people who have come to home births from previous hospital birth experiences, and they don't even know about their third stage of labor, which is the delivery of the placenta. It's just not even part of their consciousness. And at home, you know, you're still pregnant, as far as we're concerned, until you have delivered that placenta. So the delivery of the placenta is actually part of the birth. Mm-hmm. It's the final part of the birth. It doesn't have bones in its head, so, you know, people get to be afraid of, how am I going to deliver this placenta? Like, I just had a baby, how am I going to do the placenta? But no, it's, you know, it's much easier. It's, you know, your body knows what to do with that too, and you get a cramp or something, and the placenta is born. We don't generally use anything other than maybe a little bit of cord traction just to see that the placenta is ready. It's a physiologic process as opposed to a medical process of getting the placenta out. So people are very aware of that, and I spend a good bit of time at births discussing the placenta, and we do a little, you know, like to joke, you want to see a placenta show, and we do a whole educational piece after, you know, well after the birth on the placenta, and show them, you know, show the client how the baby was on the inside and what the placenta is doing and where all of the lobes are, and, you know, the amnion and the chorion and the cord, and show people, and they're just amazed by it. Children especially are amazed by it. You know, usually the placenta show takes, you know, a few minutes, but if there are kids around, they're really fascinated and they want to watch and touch it and feel it, and it's really an amazing thing. It's like they're very close to it because this amazing, beautiful organ that looks somewhat like a tree, depending upon an angle that you're looking at it at, has nourished their little sibling the entire time, and they get really excited about seeing it.
Mm-hmm.
It sounds a little woo-woo spiritual or something, but it actually is. Robin Lim, who is an amazing midwife, who I know that you know now, she values the placenta highly, and there are a lot of spiritual practices around separating the cord and, you know, the value of this placenta and what it can do, what it has done for the child, and the relationship actually that it has with the child is very, very important. And that's something that's not looked at all. Yeah, her book is beautiful, actually. Yeah.
Her book is called Placenta, the Forgotten Chakra, and so she really delves into that spiritual connection that you just mentioned, and how other cultures around the world honor and respect the placenta. They don't view it as medical waste, which is how placenta is typically viewed in the United States in a hospital birth setting. And you know, they will do ceremonies. They will bury it in their backyard. It's very much honored because this is like vital for the success of the baby, and so they are giving it complete credit for its job that it did, success baby into the world.
We actually find, and I don't know if this is, I mean, this is my own anecdotal experience, because we're doing physiologic third stage as opposed to managing the third stage. We find that when the placenta is releasing, and there are physical signs of that, such as a small gush of blood or cramping, the mother will have some cramping, that the baby actually also responds to that. the baby will scutch, or sometimes the baby will cry. It's really amazing. And we don't cut the cord until after the placenta is born. So there is no disconnection of baby and cord, or baby and placenta rather, until after the placenta is born. Part of the reason for that is we find that this is also part of the physiologic birthing. Babies have only about a cup of blood in their body at the time of birth, and up to a third of that is actually in the placenta at the birth. Mm-hmm. So you're talking about the potential for a baby with immediate cord clamping to lose up to a third of its blood if the cord is cut right away. And in hospital birth, the cord is almost always cut right away. And we wait a very long time for that. We wait until at least the placenta is born, and obviously once the placenta is born, there's no exchange anymore. Really, once the cord has stopped pulsing, there's no exchange. It's been shown that within a couple of minutes, the majority of the blood anyway has gone back and forth. That transfusion has taken place. So delayed cord clamping has, you can say 3 minutes would be delayed cord clamping, but our cord clamping, we find that it pulses much longer, and even though the blood is maybe mostly transfused, if there is still a pulse in that cord, which can be for many minutes, 20 minutes or more, we are not cutting that cord because there's something is going on that we just don't know what that is, and we're not going to interfere with that.
Yeah, there's no medical reason to do immediate cord clamping. And it sounds like what midwives have discovered is that when you do keep the baby and placenta connected until the placenta is delivered, not only is it valuable for the blood supply and the nutrition and health of the baby, but it makes it easier to physiologically deliver the placenta if it's still attached to the baby. I
believe, in my own experience, that it reduces hemorrhage. It reduces the connection of that. First of all, the baby is also not leaving the mother's side. The baby can't leave the mother's side if it's still attached. So the baby is with the mom that entire time, and so the transition for both mom and baby is much gentler and, again, a physiologic transition as opposed to a medical transition. When a cord is cut immediately, the first breaths that a newborn takes are not designed to oxygenate the blood. The baby has a high hemoglobin for a reason. That is for the stress of labor and all of that, which is normal and healthy. It's not distress, that's a different thing, but the stress of labor is healthy for a newborn. So when you cut the cord right away, you are forcing the baby to need oxygen right away as opposed to those first breaths, which are designed to clear the lungs. The first breaths of a newborn are not about breathing per se. It's about pushing fluid out of the lungs. So you have a lower incidence, at least in my experience, and I'm sure this is studied somewhere, but a lower incidence of newborns needing resuscitation after birth if you are leaving the cord intact. Mm-hmm. Because their first breaths are not oxygen requirements. Newborns at home, they don't cry as much. They take deep breaths and they clear their lungs and then they settle in.
Mm-hmm. That's
we
right,
like
and they're
cry a little bit.
The oxygen from the blood, not from their lungs.
Exactly. Exactly. Yeah. That blood that is designed to be there with the pulsing of the cord going back and forth, they still have that oxygen. Now, that's not to say that they don't have to breathe. Of course they have to breathe. We want them breathing. It's not like we're going to let them not breathe, but they are going to be breathing and clearing those lungs. And then after those lungs are cleared, then that oxygenation is happening.
Right.
So they're getting it from both sources, basically, at that point.
Right. And that's important during that transition of, from womb to outside world. Mm-hmm. I think one thing that I'm realizing is, can you just maybe describe a little more like what the actual organ of the placenta looks like? for people that have never seen one?
Sure.
And then also how long that third stage of labor, like once that baby is delivered, how long until the placenta is delivered afterwards?
Okay, so the placenta, how can we say, what does it look like? It looks kind of like a liver. I guess we could say
that was my guess.
If we're going to compare it to an organ, although a liver is very, very smooth, and the maternal side of the placenta is smooth but not, because there are different lobes to it. The liver itself is a very, very smooth organ, whereby the placenta has these different parts to it, kind of lobes. The placenta sort of fits together like a puzzle. You can see the maternal side is very vascular, so it's filled with blood.
It's red.
It's red or purplish even. Is deep maroon in color. I wish that we could do a segment where it wasn't, where there was some video involved, because I love to teach about the placenta, and it's a really fun thing. There are the membrane, there's so the membrane, there are two parts to it, the amnion and the chorion. The amnion is the baby's side of the membrane, and the chorion sort of infiltrates, if you will, into the mother's side of the placenta. And they're distinguishable. You can actually peel it away. The amnion is a very, very thin membrane, and the chorion is a little bit thicker. The amnion, it comes up onto the cord itself. So everything in the body kind of wraps around itself. If you think about, for example, the skin on a penis, on a newborn penis, where the skin wraps around itself, right, and it goes on the inside and the outside at the same time, that's a similar way that if you look at the membrane on the placenta. On the baby's side of the placenta, you only see the membrane. So through the membrane, you can see these rich, thick, beautiful vessels. So when the placenta is up against the mother's uterus, you wouldn't see the mother's side of it, right? So when the placenta comes out and you see the baby's side of it first, usually, you see this beautiful sheen because it's the membrane itself is up against that, and you can see through that, you can see the vessels. So if it's up against the mother during pregnancy, that baby is looking at that, and there's pulsing going on of those vessels at the mother's heart rate. So the baby is right up against it or can hang out by it and hear the mother's heartbeat. In utero, very, very close, because the pulse of the placenta going into the baby is at the mother's rate. And as soon as that blood comes into the placenta, the blood of the placenta is actually the baby's blood type, because it's made by the baby, right? It's the genetic component of the baby. So it's a fascinating, beautiful structure. And it looks kind of like, people say it looks like a tree. People say it looks like a brain. Because if you look at the vessel side of it, where you can actually see the vessels, it does look like a tree. They call it the tree of life, because it is the tree of life. So it could be an analog to a tree. It could be an analog to a brain.
Or even like a heart with all that vasculature.
Sometimes it really looks like the heart. I have seen heart-shaped placentas. I actually have a picture in my phone of a heart-shaped placenta, really heart-shaped.
Yeah, and I mean, like I saw my sister's the placenta she delivered, and it was about the size of a liver. But like to your point, these range. Like, what's the weight typically of a placenta?
That's a good question. I've never actually weighed one, but I feel like they're 2 to 3 pounds, I think, depending.
Yeah. And they're soft, and like you mentioned, like they're not like hard, bony, like the head of a baby coming out. So they're
it's very
really
soft,
slippery to deliver.
Oh yeah, it's easy. It feels great. It feels like $1,000,000. Like you feel, the baby being born is great, and everybody's all excited and beautiful. But when that placenta is delivered, that mom she feels so good. She's like, oh, it's such a relief, because then you're complete. Now, as far as to answer your question, I don't know, did that answer the question as to what it looks like, do you think? I think so.
Yeah, and then we were going to talk about, like, what that third stage of labor looks like.
Right. So the baby is born, and everyone is all happy, and the baby is with the mom, and hopefully, starting to just, nuzzle a little bit and do all that. And then the cord stops pulsing, and generally when the cord stops pulsing, which is within a few minutes, there is the possibility that the placenta is ready to be born. So anywhere from, quickly after the birth, 3 minutes, 5 minutes, to, certainly up to an hour after the birth, depending upon whether the mom is bleeding or not, is a typical placenta. I would say that most placentas are born within the first 20 minutes or so after the birth. But
sure.
Again, that's not a hard, fast rule. There have been placentas that take longer. Then there's always the risk, because this is a risky time of birth. It's the most tender, if you will, time, after the baby, before the placenta. There's the risk that, the mom could bleed or whatever. So we're very, very diligent during this time to make sure that mom is doing fine, and, if indeed she is having some cramping or some bleeding, that we are encouraging her to birth the placenta, whether she gets up in a squat and it just comes out, or, with a little bit of minimal cord traction to see whether or not it's right there. Because oftentimes it releases, but she doesn't have a desire to push it out, like she doesn't really feel it, because it doesn't have the same impact that the baby's head or body would. So sometimes it's just sitting right there, and she just needs to change a position, sit on a birth stool or something, and it comes out. We are not, yanking on cords and going in after placentas, that's for sure. We don't automatically give Pitocin to deliver a placenta. In the management of third stage in the hospital, they give a shot of Pitocin or increase the Pitocin in the IV as soon as the anterior shoulder is born. It's just called active management of third stage. And in fact, active management has been shown to decrease hemorrhage in certain situations. But because we're not doing interventions that could necessitate getting that placenta out quickly, we know for ourselves at home that a physiologic third stage works much better. Which again just goes to, the purity of birth, and we know that birth works and how to do that. So it can be anywhere from a few minutes to, an hour or more sometimes. I'll tell you, the midwives, we don't like it so much when it's so much more than that, because like, now what's going on,
Right. Yeah, you're like 20 minutes, that placenta should be out by now.
Yeah, let's just do it. But I've had cords that pulse more than 20 minutes. The cord is still pulsing at 20 minutes. It means if the cord is still pulsing, that placenta is not detached. So we're not, forcing it at all.
Right. I mean, Robin Lim talks about in her book about, a full lotus birth, where once the baby and placenta are both delivered, they're never separated. The cord is never cut, and it's allowed to separate naturally, like 5 to 7 days after the birth.
Right.
They just wrap up that placenta, and it's carried along with the baby everywhere it goes.
And it's when the baby and the placenta want to do that. That's, it's funny because we all have our comfort level, right? And I've had a few people in my practice who choose lotus birth, and that's perfectly reasonable and fine. It's amazing how fast the cord dries. In that, it gets like a telephone wire almost, and it's very, very hard. So even if you wanted to cut it at that point, it wouldn't be so easy to cut that cord at that point. Because it gets so hard, almost like you'd need a wire cutter or something, a sterile wire cutter to cut it. But and I have had a couple of people who have chosen that. I'm not so sure, this is just, again, my own opinion, whether or not in nature we would have walked around with the placenta for days, because in times when we were living in nature, before we had cities, like there could be a potential predator issue. Certainly with other mammals are not keeping the placenta and the baby together that whole time.
Right.
The other mammals are disposing of it very quickly, in fact, through eating the placenta, which we have, some history of, but only recent, much more recent history that we know of. I mean, who knows? Because you're not going to find remnants of placenta when you're doing a dig. You'll find remnants of bones, but placentas have no bones. So we wouldn't know exactly how placentas were handled in times, in non-modern times.
Mm-hmm.
When if you're doing an archaeological dig and you find bones, you're not going to find placenta.
No, it's just tissue. It's definitely gone.
It's just tissue, exactly.
What about in the past couple hundred years where we have records?
Right. So there has been some, if you look at the research, there's been some research on placenta ingestion by humans, and that's, part of this conversation is about placenta encapsulation and different ways that people use the placenta, for themselves as supplementation or medicine or however you want to call it after the birth. Regarding the research about it, there is not a whole lot. I have a student, was one of my students who did a research paper, it's almost been 2 years now, actually. She did a research paper on placenta use and the perceived effects. I think it was called Perceived Effects of Placentophagia, and it was a wonderful paper with over 250 responses to a survey that showed a variety of uses for the placenta. And in her research, she went and, tried to find placenta research, and there was not a whole lot that has been done on it. So there has been some, and some of that research says, well, we shouldn't be taking it because there are toxins in the placenta. So there is some people who would say, well, you wouldn't do it because of that, and then there are other people that say there are great benefits to it. So it's a mixed bag out there, and there's not a whole lot of research being done. We are very fortunate that the Midwives Alliance of North America has just added a module to their research database on placentophagia. So I'm excited. I'm the treasurer, actually, for the Midwives Alliance of North America and the Division of Research. There was someone who wanted to do a research study on placentophagia, and we improved the data gathering and added a module on that. And so now there is a very big research project through the Midwives Alliance of North America that's going on in this regard. So hopefully soon we'll have some really good information on it.
That's exciting. With all the midwives that are a member of that organization, they can submit data that they see firsthand in their practice and collect all that data together to get some real, good information.
Well, and they're doing that on all kinds of issues. Right now, the database is getting over 1,000 entries a month from midwives all over the country who are submitting data on their births for the prenatal care, the birth, the postpartum, all of it. And really good research is coming out. There's going to be a water birth article coming out soon, and all kinds of really wonderful research. Last year, 2 articles came out in the Nursing Journal on the papers that are coming out of that particular database, which is a really amazing database. Over 70,000 records are in there now.
Wow. Yeah, that's a lot of information. Yep. Great.
So it's exciting that placentophagia is now one of the things being researched.
Yeah. So can you explain to us what that is?
Sure. So there are a number of people who many people now who have decided that they want to take their placenta, and it can be done in a variety of ways. I mean, this conversation was going to be about placenta encapsulation, but placentophagia itself is the term that's used for someone who is ingesting their placenta. So it was interesting that when I was very early in my career, I went to Chinatown to a Chinese herbal store and asked about what can I get Chinese herbs to help to prevent hemorrhage. And the man who was at the store said, what about placenta? And in his Chinese accent, he's saying, don't you use placenta? And I said, what are you talking about? And he said, well, we give women placenta after birth to prevent hemorrhage. And so once the placenta is born, if a woman is hemorrhaging, it can be used to help to prevent bleeding by taking a small piece of that placenta and giving it to her and having her swallow it or put it under her tongue, and it will help to stop bleeding. If you think about it, it's loaded with hormones. And so it has the capacity to do that. So that was really my first introduction to placentophagia, was through this gentleman who said, well, do that. I was like, well, that's really interesting. And then I started doing a little bit more research on it and found that there were people all over the place who were ingesting the placenta in a variety of, for some people will take it raw right after the birth. I mean, this might get a little sketchy for some people. People will be listening to this and turning up their nose, but placenta smoothies and cooking it and eating it that way is all practices that are being done with people feeling very, very strongly that it helps them to recover quickly. Mm-hmm. So I had a particular client who, after one of her births, she had very severe postpartum depression to the point of actual psychosis. God bless her. She was, seeing things on walls that weren't there, and it was really difficult for her. In the following birth, she took her placenta and did not have that experience. Now, do we know for sure that had she not taken the placenta that she wouldn't have had that experience? Of course not. But she felt very strongly that the placenta kept her balanced. And wow. I have seen in my own practice from a number of people who have had severe emotional issues after previous pregnancies have not had it after using the placenta in the postpartum period. And it's not just once, it's not just twice, it's a number of times. And my practice is relatively small. 40 to 50 births a year, and however many people, ingesting the placenta, maybe 25% of them. But for sure, people are finding that it is beneficial in a variety of ways of ingesting it. You can freeze it and use pieces of it in, like I said, in smoothies if you're wanting to do it raw. And raw, it seems, there is more of an immediate effect as far as energy goes. People get their vitality back quickly when ingesting the placenta. People who have felt like their blood was a little bit too low, they ingest the placenta raw and they feel like they get their, like I said, their vitality back. There are also ways of encapsulating the placenta where either someone in your own home or someone outside who does this as a service can encapsulate the placenta, where it gets cleaned and the blood, most of the blood is removed, the cord is taken off and stripped of any blood that's in it. We use all parts of the placenta, so the cord will also be dehydrated and ground into a powder. The cord, the membranes and the placenta itself, there are different ways of preparing it for encapsulation. It can be done raw itself, again with this vitality in mind, and dehydrated at a low enough temperature so that it's not cooked. That can be done. Some people prefer it done that way. And then there's what would be called the traditional Chinese medicine method, which is the placenta is, cleaned and as much blood taken out as possible, and then it is steamed in lemon and ginger and jalapeno, believe it or not, because these are very warming herbs. And so the idea is to create a tonifying effect, which is a longer lasting effect. And then it is steamed for, 15 minutes on each side and sliced very thin and put in a dehydrator. Of course, these are all dedicated pots, dedicated knives, dedicated everything. So it's, a very clean process. It's used gloves and blah, blah, blah. We're taking appropriate care of ourselves. We know the person that we're doing this for. So yes, we're exposed, but we're also aware of someone's status on a variety of issues. And then it's dehydrated over a period of 8 to 12, sometimes more hours, depending upon how thick you cut the pieces, slice the pieces. And it's then ground in, like a coffee bean grinder that, of course, is only used for placentas. And then we put it into capsules. And again, like we were talking about earlier, the process of doing this, for me anyway, when I do it, is a spiritual process.
Yeah.
I am infusing my own love and positivity into the work that I'm doing. And I'm thinking about that woman and her baby. I know about them because I have gotten to know them in their pregnancy. Now, there are placenta encapsulators out there who don't know their client, but they still know of their client. They've had phone calls with their client. There is a connection there. And so for myself, every time I close a capsule, because you have the capsules, you make these little capsules, but then they have to be closed a little bit more in order so that they are fully closed, right? You press on it. And I'm like blessing it every time. So it's like in a way, I don't know if you've ever heard of a prayer blanket where every little corner of the prayer blanket, somebody says a prayer for everything. And so I'm kind of doing that when I'm doing the placenta encapsulation. So there's a tremendous amount of good intent. And I really believe that also makes a difference. But that's my own, that's my own spirituality that I infuse in these things. And people know that. People know who I am when I'm, doing a placenta encapsulation. And so you can get anywhere from just under 100 or so. The average number of capsules I get is about 130 or so, but I get like 96 sometimes. I've gotten as many as 196 capsules from one very large placenta. So there's no telling how many you're going to get. It just depends on the size of the placenta.
Right. And so once they're encapsulated, you're getting this back to the woman like a few days postpartum.
Yes, and in a very reasonable amount of time.
Right, like usually within a week, right?
Absolutely, because the placenta, you don't want it to be, first of all, it needs to be refrigerated, obviously. So you're going to refrigerate it in that first day until the placenta encapsulator gets it. And then it's, you want it done within a couple of days.
Right. And so then once it's done, you have these capsules back to the woman. How is she using the capsules?
Right. So she's taking generally 1 to 2 capsules up to 3 times a day. Now, who made that prescription? Nobody. Right? This is not drugs. It's a supplement, and it's her own hormones. So she's kind of guiding what she's doing. So the recommended dose, based on, I don't know honestly who, and one could say, wow, that's really terrible, but it's the woman's. It's not like she's taking somebody else's placenta. She's taking her own.
Right.
The recommended dose is 1 to 2 capsules up to 3 times a day. So if they want to make it last longer, they'll take less. If they feel differently and they feel like they really need the support, they'll take it more. It's also intuitive. And so I have said to somebody a couple of weeks out, are you still taking your placenta? She's like, oh, I haven't taken it in a couple of days. I'm doing pretty well. I don't think that I need it anymore. Or I have actually heard somebody, a husband who came home and his wife was, behaving in a way he was surprised, and he said, did you take your capsules today? And she forgot, and sure enough she takes them, and then a half an hour later she feels more balanced. And that may sound crazy, but But these are the experiences that people have. I've had people say that their milk supply has increased. I had a person, one of my own clients, who had incredibly high milk supply, like overabundance of milk in a previous pregnancy or a previous postpartum period. And when she was taking the placenta pills, her milk was regulated to normal, and then she stopped taking them because she thought she was done, and she went back to overabundance. And then she went back and it regulated to a normal abundance. So it's a hormone balancer. It's not, necessarily, in quotes, a happy pill, but it's a hormone balancer, which I thought was fascinating.
Like you said, too much or too little, this is about that optimal hormone levels for that woman, no matter what really her symptoms are. It can just really help her heal and recover a lot faster physically and emotionally after the birth.
That has been our experience. Yep.
So cool. And, besides having like raw placenta or capsules, you mentioned you could cook it. And then what about like even like a tincture?
Yeah, so sometimes we'll tincture the placenta. I just want to say quickly, though, about the taking the capsules while we're still on that. If someone is unwell, if she has mastitis, if she has a flu, if she's sick, she actually should not take the capsules. The reason for that is that it has a tonifying effect, which is a deepening. So if you don't want to deepen an illness, so we recommend that if someone is unwell, that they stop taking the placenta during that time, which is kind of an interesting point. And I just wanted to kind of throw that out there. And
yeah,
I'm
very
sorry.
important too.
Yeah. So go back to your question. I apologize. I missed what it was.
So the question was, like, we mentioned there's multiple ways to consume the placenta after it's been delivered, and I was hoping you could cover some other ways.
Oh, the tincture.
Like a tincture, for example.
Right. So to make a tincture, what we do is we take a very small part of the placenta and put it in vodka and let it sit for 6 weeks. And then strain it out, because obviously there's going to be some small amount of disintegration. But then we put it through a very, very fine strainer and put the vodka back in the bottle. And then that is what the placenta tincture is. And you can take that tincture and use it for the baby, because the placenta is the baby, remember. So if you take that tincture and say a baby is very anxious or crying or, in quotes, colicky, you take a few drops and put it on the baby's wrist or the baby's ankles, and people have described that the baby calms right down. A mother can also take that tincture in times of stress and take, 10 drops or something under her tongue and take that in times of stress. Now, the amazing thing about it is if homeopathic remedies can also be made. So you're doing this tincture, and then you take a few drops of that vodka, put it into another tincture bottle, and then let that sit, and then take a few drops of that, put it into another tincture bottle, and you go on, and the remedy becomes more and more powerful, and it is a specific remedy to that baby and mother.
Right. It's
now,
so powerful.
I personally do tinctures, but I don't know necessarily. I know of people who will do the homeopathic remedies, but I'm not a homeopath, so I'm not doing those. But I have tinctured, plenty. But generally, they sit for 6 weeks, so we can give it to them at the 6-week postpartum visit.
And I know I've heard that it's nice to have that sometimes on hand, because, like you mentioned, if your placenta produces about 100 capsules, potentially you're going to run out, in a few months.
Exactly.
And so sometimes it's nice to have that on hand, and I've heard it, being helpful even for women when they're, years later after giving birth, going through perimenopausal symptoms. Once again, to help, balance hormones, the placenta's been used. I mean, it's pretty amazing.
Exactly. It is amazing. Yeah. It is. And I don't know, like, how many years later, because I'm not at the point with my own clients where I'm going from, like, they're all still birthing women as opposed to perimenopausal women for the most part. So I'm not sure in my own practice. I have not witnessed that as benefit, but it certainly has the capacity for it. And because if it is tinctured, for sure, it will last forever. It's tinctured in alcohol.
That was the other point, where the capsules, a woman would keep those capsules probably in the refrigerator, and they do have a shelf life.
Yeah, I would think that they would have a shelf life for sure, like any other herb, any other herbal supplement.
Right. And so ideally they're completely consumed within, what do you say, within a few months after birth?
It's hard to say. Like, I know for myself, if I have supplements can stay in my cabinet for a number of years, so I don't know what that shelf life would be. And again, I think that it's important that people follow what their body is telling them to do. If it seems like maybe you could do muscle testing, like somebody could do muscle testing on themselves and see whether or not the placenta is right for them anymore. Yeah.
Right, or how much, even what their dosage is, their body's needs are. So it is so cool. I mean, there's even people that do placenta art. Do you want to talk about that a little bit? Yeah, you can do a print. Sure,
it's really fun, actually. The placenta, you can do a placenta print. So basically, we have the placenta and we lay it out, and of course there's blood in the placenta. And so then if you just, obviously with a gloved hand, you take some of that blood and you put it on the top, on the side that's the baby side, because that's the side that is the side that looks like the tree. And then you can lay the cord out how you like, and then you take a piece of art paper or even, copy paper and put it on top and very gently press on it, and then you peel it away, and there is a beautiful print. Some people will take the cord and use the cord and dry the cord separately and do it as a kind of like a keepsake, do it in the shape of a heart or a spiral or something. There are people that will do that. I did that in the beginning, and then I just thought, I would rather them have more pills, so I just use the cord and just, use the cord as part of the encapsulation. But there are certainly people who are making these little keepsakes, and the placenta prints are beautiful.
Mm-hmm. Wow,
it dries.
So neat.
It dries, and people will frame them or just put them up, or who knows what, they put them in the baby book or something,
Mhm. Yeah, and in those cases, it really looks like a tree because of that vascular component, right, of the placenta.
Mhm.
So, do you have any last thoughts that you want to share about placentas?
Well, my only thing is I would just love it if people had a sense of how important that placenta is to the baby, and that it is the baby and part of the baby, and rather than just toss them aside and throw them away, that we, talk to the baby when you're cutting the cord. Tell the baby that this is happening, that, you don't need this anymore. You're going to be breathing on your own, and you have mommy from the outside now, that you don't need it anymore. And I think that the more we honor all of these phases of what's going on in childbirth, the more peaceful things will be, and that we'll be able to get back to a more natural and physiologic and non-worrisome way of childbirth than what we have turned it into here. And these little things, these little honorings, I think make a big difference.
Wow, it's communicating with that newborn. It's not just working on them, it's actually working with them. And I think a lot of people just don't they don't understand that babies do feel and understand and are completely conscious when they're born.
They're extremely responsive. Responsive. We talk to them at their newborn exam, and they are extremely responsive. We're looking for a variety of things that are going on, and they know exactly what we're doing. We just have to pay attention. And I think if we slowed down enough, we would be able to pay attention. And so this, delayed cord clamping until the placenta is born would force that a little bit.
Right. Yeah, it's so powerful. You had mentioned before the interview that there was a website or some resources that people could get more information.
Well, if you're talking about cord clamping itself, there's cord-clamping.com. I'm sure just looking up, placenta encapsulation, you'll come up with all kinds of websites. There is a page on my website, which is seventhmoonhomebirth.com, on placenta encapsulation, where there's a little bit of information. And, yeah.
Great. Well, thank you again for coming on and sharing your passion for the placenta.
Thank you, Laura, for having me.